各位媒体朋友，大家下午好，欢迎参加今天的发布会。春节假期马上就要结束，很多人即将返回工作岗位，如何做好健康防护？不同人群需要哪些注意事项，也是现在普遍关注的问题。为此，国家卫生健康委组织专家专门编印了公共场所和不同风险人群卫生防护等工作指南。今天我们请来了国家卫生健康委疾控局副局长王斌女士，中国疾控中心环境所消毒中心主任张刘波先生，中国疾控中心传染病处研究员冯路钊先生，请他们围绕今天的主题 公共场所、交通工具以及不同风险人群的健康防护，来回答大家的提问。首先通报一下疫情情况。2月1日0时至24时，各省区市和新疆生产建设兵团报告新增确诊病例2590例，其中湖北省1921例，新增重症病例315例，其中湖北省268例，新增死亡病例45例，全部为湖北省病例，新增治愈出院病例85例，其中湖北省49例，新增疑似病例4562例，其中湖北省2606例。截至2月1日24时，国家卫生健康委收到各省区市和新疆生产建设兵团累计报告确诊病例14380例，现有重症病例2110例，累计死亡病例304例，累计治愈出院病例328例，共有疑似病例。
In total, 304 death cases, 328 recovered cases, 19544 suspected cases. Up to now, we have traced 163844 close contacts. 8044 people have been removed from medical observation, and 137594 people are receiving medical observation. From Hong Kong, Macau, and the Taiwan regions, we have received a report of confirmed 31 cases, including 14 from Hong Kong, 7 from Macau, and 10 from Taiwan. I understand that many media are watching very closely the treatment. To curb the spread and strengthen treatment are the priorities. On February the 1st, NHC once again mobilized professional resources throughout the country to ensure the treatment of the severe cases in Wuhan. Among them, we find the hospital presidents and department chiefs from China-Japan Friendship Hospital, the #1 hospital affiliated to Peking University, the Renmin Hospital of Peking University, and the #3 hospital affiliated to Peking University have all been to Wuhan. And also we have experts from Guangzhou, Zhejiang, and China Academy of Medical Sciences. Altogether, today, 200 professionals are to arrive at Wuhan. Now the Q&A. Thank you. From CGTN, we know that the primary and the middle schools have postponed the school start, and in some regions, the back-to-work time has also been delayed. Now, some of the people are staying at home while the others are returning back to the cities. So there's a big pressure in terms of transportation and prevention and control in the public places. So what are the specific measures? Let me give the floor to DDG Wang Bing. Thank you for the key question. Indeed, as the Spring Festival holiday is coming to the end, people are back to their work. In such a situation, for different facilities and different sectors, considering the different features and also the different risk populations, we have worked out guidelines to offer guidance. For example, in public transportation facilities like airplanes and trains, first, it is necessary to strengthen disinfection. Disinfection frequency should also be strengthened concerning other public facilities. Second, to improve ventilation. For high-speed trains and airplanes, the cabinets are quite closed, so it is necessary to increase the ventilation frequency. Also, if you are to take the airplane or the train, try to have more space among people. For public transportation like buses, natural ventilation should be emphasized. However, in the north part of the country, it is still very cold, so disinfection frequency must be enhanced. For long distance buses, for passengers on the long distance buses, we suggest them to distance themselves from others, and also such buses should have a break every 2 hours, and also the windows should be opened to have a ventilation. For taxis, it is necessary to have disinfection prior to the work of the day. Also, it is necessary to constantly provide public health information to the passengers and the conductors or the drivers. Furthermore, for shops or supermarkets or department stores or our workplaces, it is also necessary to have indoor disinfection and improve the air circulation. Of course, people who work in those public facilities should pay special attention to their personal hygiene and health. They need to wash their hands frequently and carefully. And also, if they have any symptoms, they should refrain from work and stay at home. Also, if possible, try to distance yourself with others. In workplaces like office buildings, we are to strengthen the management. So the entry record and also temperature take should be continued. In our website, you can find the details of such protection measures in public places. Okay, next question. On the first row, thank you. From People's Network. Now we have office buildings in urban areas who usually adopt the central air conditioning. So we have the internal or indoor air circulation. According to media reports, there's a company with 30 people having a meeting and 11 got infected. So there's a high risk of the spread of the epidemic. Any potential or any specific measures against such potential spread. For the central air conditioning, before it is in use, it's necessary to have disinfection concerning the key components, and also we should be aware of the parts which should be disinfected.
Second, for office buildings with central air conditioning, they have very strict design and strict protocols to follow. If enterprises can follow the protocols of use, then it should be safe. Third point I want to make is that in most public facilities in China, the central air conditioning has the free air, and the piping system of high standard. The pipelines, just like the home air conditioner, only that it has added with a free air system, so that the room will be of a positive pressure environment. So it's just like the home air conditioner. In terms of the positive pressure environment, we can enhance the free air inflow so as to ensure the positive pressure. And the air flow is beyond control. But by discharging the air, we can ensure a more orderly flow of the air. Of course, if there is epidemic outbreak, we should stop the use of the free air system or central air conditioning. According to certain requirements, we should readjust the central air conditioning system and give it a thorough sanitation. Then we need to re-evaluate the environment as to whether the central air conditioning can restore its work. Apart from these points, in workplaces and the public facilities, there is the problem. There is a density of workers and office staff. Therefore, we recommend the use of masks. If conditions allow, before workers and officers enter the office buildings, temperature monitoring is recommended so as to early detect those who have a fever and adopt precaution measures thereafter. There were also questions on disinfection in public facilities and office buildings. I have several points to make. First, in lifts, the buttons, the door handles, also the water taps, and public phones. Yes, there is frequent contact of these key points. So these should also be the priority of our disinfection efforts. For the ground surfaces and the table surfaces, if conditions allow, we can also enhance the sanitation and disinfection frequency. Like in the past, disinfection was done once daily, and if the sanitation workers have time, they can do it again at the noon time. Also, in workplaces, we should minimize discussion with face-to-face discussion and minimize the face-to-face dining together. There is mounting tension across the country, so we see over-disinfection is happening in certain places. For that, I have my personal opinion. Disinfection is effective in curbing spreading. It is an important measure. However, the other side of the coin is that disinfection must be well targeted. Disinfection of the streets and the frequent disinfectants sprayed on the streets and even on the car wheels are not necessary. They are not meaningful, or in my opinion, it is even meaningless without a clear target. Besides, the disease is transmitted via the respiratory tracts. So there are practices where disinfectants are used to sanitize the air. Then such efforts must be conducted in areas and environments where there are no people if disinfectants are sprayed on people themselves. Then it carries hidden risks where we cannot give quantitative evaluation and assessment. We should avoid disinfectants direct spray on people currently. Next question, please. Journalist on the second row. From China Demographic Reports. People are coming back to their work, and there are some special risky groups like the shop attendants, those who are working at subway stations, subway security, and also journalists who are exposed to higher risks than average and ordinary people. Do you have specified precautions for them? I'd like to ask researcher Feng Lu Zhao from the Infectious Disease Department of CDC to take that question. You've talked about some special risky groups, including taxi drivers, bus drivers, sanitation workers, attendants working at the airports, including customs, quarantine areas, and the shop attendants, restaurant attendants, journalists, security people, and the delivery boys, they are exposed to a greater number of population, therefore exposed to a higher risk of infection. Therefore, they should have special precautions. They must wear masks and other protective equipments. They should do a better job in daily disinfection. They should have better hand hygiene and the self-protective measures. They must wear masks before they take any work assignment. If there is distortion of the masks, the wetting of the masks, they must replace their masks. They should pay special attention to their hand hygiene, wash hands with soap, and also running water. They must take their temperatures twice, at least twice a day. If it is not convenient for them to wear the protective garments, they must wear masks if they show certain symptoms like fever, coughs, diarrhea, vomiting, fatigue, the muscle soreness, and throat soreness. They must stop work and seek medical services. Next question, please. A journalist over there on the second row. Thank you, Director Mi. I'm from CCTV, CNR. When we take public transportation vehicles, we may touch the handles, the door handles, and we have to sit on the chairs. We may also contact others, but we cannot wash our hands immediately. We know on the market there are available disinfection and sterilization. Napkins, can we use them? Can they be effective? I'd like to ask researcher Feng Luzhao from the Infectious Disease Department of CDC to take the question. Disinfectants and sanitation towels and napkins, are they effective for keeping hand free of virus and bacteria? There are two ways to keep our hands clean. Wash hands with running water. Second, use the hand disinfectants. If we wash hands with running water, we have to have running water in the first place. Just as the journalist has rightly pointed out, if you are on a public transportation vehicle, you do not have access to the running water. And also, there are very strict steps to follow. We have to wash the insides, the exterior surface, each finger, the places between the fingers, and also thumbs. So we have a very strict 6-step hand washing know-how. And for surgical doctors, they have to wash strictly their wrists as well. When people are on public transportation vehicles, they do not have access to running water. In cases like this, they can use hand disinfectants to keep hands clean. The hand disinfectants should be used following the 6 steps, and they must be put on the 6 parts of the hands. Alcohol-contained hand disinfectants are the most commonly seen. There is very rapid evaporation of the alcohol, and the disinfection effect is good. And if people are allergic to alcohol, they can use alcohol-free disinfectants. If people do not have the disinfectants, they only have the sanitation towels, then clean your hands with the towels or napkins. It's better than nothing is done. But when you use the sanitation towels or napkins, they may not be as convenient as the applying of hand disinfectants.
Next question. On the right, the journalist raising hand from Fengmian News. As we know that a lot of rural migrants are also coming back to the cities. Do they need to be isolated? If yes, how? Also, for construction sites and factories, any specific measures? Also, for these migrant workers, they live in dormitories and they don't or they can't wear masks while asleep. So, any strengthened measures to protect them? Thank you for your question. Indeed, this is a question of great interest or concern. First of all, the companies should work according to the requirements. They should develop preparation plans and set up mechanisms to have these protective measures in place. For the rural migrants, before they come back to the cities, they should take their temperature and see if they have any symptoms. If not, then they can, on their journey back to the cities. Otherwise, they need to seek medical advices. Also, for people who have been to the epicenter or who have been close contacts of the confirmed cases, then they need to wait for 14 days as an isolation period before they go back to the cities. And of course, on their way back, they should have protective measures, try to distance themselves, and also to have hygiene or hand sanitation. When they are back to the cities, the companies should have a body checkup, take temperatures, and observe whether there are symptoms. If yes, then there should be isolation. Also, there should be public health education materials posted in the workplaces. After the company starts work, there should be daily temperature take and minimize the unnecessary events or activities or to move outside. Also, there should be strengthened environmental health measures and supply of the hand sanitizers or disinfectants. Also, if it is an enclosed working space, then masks must be worn. And for restaurants or for canteens or dining halls, we can adopt measures like the shift of the peaks, and there are specific requirements concerning people who monitor the health of the workers, and overall, for all the construction sites, the dormitories, and the factories, there should be public health or public awareness measures implemented. Disinfection should be conducted, and the used masks should be collected and handled appropriately. Next question. The gentleman on the third row from ChinaHealth. As we all know that in the urban public transportation facilities, there are a lot of people, so any specific or detailed guidelines for them? DDG 1, please. This is a very good question. Based on our current knowledge of the novel coronavirus, it is spread mainly by droplets and also some contacts. So for different risk populations, and we have to consider the different features of such population groups. So recently we are working on this and we have categorized the population. The first is people who work in the isolation spaces. Also, people who are engaged in the epidemiological surveys and transfer of the patients, as well as those who collect samples from the environment. They have a fairly high risk of infection. The second group is occupations who have a lot of contacts with the suspected cases or confirmed cases. So like the conductors or air hostesses, the drivers, taxi drivers, the shop assistants, the traffic police, the subway security, and also journalists who are present today. You need to communicate with people every day, so you are exposed to high risk. And thirdly, we have people who have to leave their home and go to those densely populated public facilities, or you have to take the public transportation to go to work. And the fourth category, or the fourth group, is people who stay at home, and they may be at a lower risk of infection as they don't have suspected cases or confirmed cases at home. Also, we have community workers or volunteers at the community level in order to offer well-targeted guidelines or guidance to the different population groups. Recently, we have worked out a guideline for protective measures for different population groups, trying to answer those technical questions. You can also ask the experts. I do suggest you log on to our website or our Health China app to get information on such suggestions or technical guidelines. It is also my sincere hope that through the journalists who are present today, you can help us to promote such public awareness or public health knowledge to the general public and to the specific target populations. Such knowledge is really necessary. Thank you. Next question. The gentleman on the third row. From South Metropolitan Newspaper. I'd like to know if there are any measures for the online car hailing services or taxi drivers, and also if there are passengers who have suspicious symptoms in the aircrafts or in the trains, what are the measures that we should take? Dr. Zhang, could you please answer the question? Let me answer your second question first.
In some relatively confined spaces, such as airplanes and trains, if there is the sudden onset of symptoms, what should be done? Since there are higher risks in these relatively confined spaces, we have drafted technical measures and guidance on the sanitation and disinfection on public transportation vehicles. This guidance had been worked out under the Joint Prevention and Control Working Mechanism and directed by the State Council. The surface disinfection must be conducted, ventilation must be enhanced, and the staff must pay special attention to their own health. Education dissemination must be conducted on these public transportation vehicles. We also suggest the avoidance of transportation rush times and rush days. We also make such suggestions to the passengers. that in crowded and confined spaces they must wear surgical masks and respirator masks, and they should distance themselves from other people if possible. In this guidance, there are specific mentioning that in confined spaces such as airplanes and trains, there should be reserved areas. For example, the last 3 rows can be reserved for taking care of the people with the sudden onset of symptoms. And if indeed there is the sudden showcase of such symptoms, they should follow the orders. For car hailing services, disinfection conducted on the taxis carry smaller risks compared with trains and airplanes. Before we take the taxis, we can use the disinfection napkins to clean the places that you may touch. We can also ask the taxi drivers to wear masks. Being a passenger after the ride has completed, you can also clean your hands again. These are sufficient. Next question, please. On the 3rd row. Thank you. I'm from the financial channel with the CNR of CCTV. There are reports saying that the smoother the contact surface is, the longer and the higher survival rate for the virus. When we take public transportation vehicles and when we are in the lift, there are smooth surfaces that we have to touch in certain communities. In the lifts, there are napkins provided, so those who take the lifts can use the napkins to touch the buttons. Are they effective measures? I'd like to ask Director Zhang Liubo from the Sanitation Center of CDC to take the question. I think there might be some misunderstanding in such sayings on clean and smooth surface. Microbial burden cannot survive long. Viruses survive longer in dirty, dark, and wet environment, not on smooth and clean surfaces. Some tend to believe some misconceptions that the handles and the buttons in lifts may carry higher risks. Such higher risks are not because of a longer survival time of the virus. Rather, it is because these are places people frequently touch. You may touch it. I may have touched it. It carries the cross-infection risk. Therefore, on smooth surfaces where there is a high frequency of contacts, there is also a higher risk of cross-infection. We have 3 countermeasures. First, enhance disinfection frequency. In the past, lift may be disinfected once daily, but now can be disinfected 3 times daily. And we can also use the napkin or tissue paper to touch such buttons so that your hands do not touch these places directly. And if you have touched these places, you can use the hand disinfectants to rub your hands and to keep your hands clean. So these 3 countermeasures are effective in ensuring no further cross-infection from the lift buttons or door handles. Thank you. Next question, please. Journalist on the 4th row from the right side. Thank you. I'm from Xinjiang New Beijing Daily. There are special groups of people that are worthy of our special attention. Those who work in quarantined zones, who are working in observation areas, ambulance drivers carrying the suspected and confirmed cases, epidemiological investigators, sample collectors, and those who work in biosafety laboratories, sanitation workers, and those who have close contacts with the suspected and confirmed cases. What are the special precautions that should be provided to these especially risky groups? I'd like to ask researcher Feng Lu Zhao from CDC to take the question. Thank you for your concern on these especially risky groups. Yes, indeed, they have close contacts with the confirmed cases. They are also dealing with the virus directly in the labs, therefore constituting a higher risk, and they need stricter protection. For those who are working in quarantined zones and who are working in medical observation zones, the ambulance drivers who are transferring the suspected and confirmed cases, they must wear the protective garments, disposable masks, gloves, protective surgical masks, and also the filter respiratory masks and other PPEs. They should wear protective shoes, boots. This is the first category of special attention. And the second, for those who are conducting epidemiological survey on the close contacts. For those close contacts, no symptom has been shown yet, so disposable hats, protective garment, disposable masks, disposable gloves are recommended. But they are also recommended to keep at least 1 meter in distance with the close contacts who are under survey. And when they are conducting epidemiological survey with the confirmed and suspected cases, masks must be of a higher level. N95, N99 masks and medical masks must be worn. They also need to wear the protective shoes, boots, protective garments. When they are conducting epidemiological survey on these suspected cases, we also recommend, if possible, they can use the video communication or telephone communication so as to avoid direct contacts. And for those who are collecting medical samples and those who are working in biosafety laboratory, we recommend the wearing of protective garments, hats, disposable masks, but they must wear 2 layers of masks or N95 masks or respiratory masks, protective boots, shoes. When necessary, they are also recommended to wear the waterproof aprons. Another type that need special attention and care are the sanitation workers who are cleaning the contaminated areas. Again, protective hats, gloves, and also the gloves must be thicker and longer. And there should be 2 layers of gloves. Within it is protective gloves, and outside is the waterproof long gloves. N95 masks, waterproof aprons, and protective boots and shoes. For the sanitation workers in the contamination areas, they should wear respiratory masks based on the environment that they are cleaning. Different levels of respiratory masks must be used to ensure the proper pressure. In the interest of time, we can only take 2 more questions. Journalist on the 4th row on the right side. Thank you. I'm from Zhongxinshe News Agency. We've learned that medical staff and also the screening staff are faced with the difficulty of a shortage in medical supplies. Will they become the new source of infection? How can we ensure their safety? I'd like to ask Director Zhang Libo from CDC to take the question.
At present, the epidemic is really at a critical period. Indeed, a lot of protective devices and materials are needed. We need to ensure the health and safety of the healthcare providers at the front line. This is the basic guarantee we must offer. Also, with the training and the various protective measures, we wish to ensure the health and the safety of the people who are working at the front line. I would also like to say that I have many friends who are professionals in nosocomial infection, and also they have been working very hard since the start of the new Lunar New Year. So if we find any suspicious symptoms, there must be timely quarantine and also timely rest to guard against such potential risks. Last question. The journalist from 大公报 recently, it was found in the fecus of the patients, and shall we guard against the potential risk like those in the SARS outbreak in Hong Kong? Well, indeed, in Wuhan and Shenzhen, and even in the US first case, the test result was positive in the excrements of the patient, but it is not clear whether there is the fecal mouse transmission or the fecal droplet transmission. So we need further studies. But of course, the major transmission mode is the close distance droplets and contacts. But the recent discovery also indicates the importance of hand washing, because when we have touched the contaminated surfaces, we need to clean our hands to ensure the safety. Now, we have the experts answering the questions, and thank you very much for your questions. That's all for today's